Hey everybody, want to talk a little bit about what a nurse practitioner is, what a physician assistant is, and how they compare to each other, what their limitations are, what their strengths are, and really what their perceptions are. Now, all of this may vary from territory to territory, from part of the country to another part of the country, and I can sort of give you my assessment of what I think is the perception of each of these professions. First of all, you should know that each of these professions, both nurse practitioners and physician assistants, are sometimes called different things. Sometimes physician assistants are just called PAs. Sometimes they are called physician associates. There's been a movement, and I think I've talked about this a little bit in a different tutorial, about how there's been a movement to refer to a physician assistant as a physician associate, because physician assistant tends to have more of a sort of a derogatory, lesser connotation to it, and physician associate is more of an association to a physician rather than a subordinate. When it comes to a nurse practitioner, you may hear various terms for that profession as well. Nurse practitioner, advanced placement nurse practitioner, which is APRN. And then going back to physician assistant really quickly, RPA is also another one that I see a lot that comes up in New York. But again, research in your specific territory what the common term is that is used to refer to each of these professions. Essentially, both of these professions have their bachelor's degrees. Okay, so any individual that's either a nurse practitioner or a PA has a bachelor's degree. The difference is that a nurse practitioner, in order to become a nurse practitioner, must have a bachelor's degree as a registered nurse. And then they can go to obtain their advanced degree. When it comes to a physician assistant, they need to, of course, have a bachelor's degree, but that bachelor's degree can be in anything. It can actually be in history or, political science or archaeology. I mean, like anything at all. However, they then have to, if they want to pursue the program for a physician assistant, they have to then go and get those prerequisites. A lot of times it's like that biology, chemistry. And then once they've established that and have completed those prerequisites, then they can enter into a physician assistant program. So there are some differences when it comes to what a physician assistant can and can't do, what a nurse practitioner can and can't do. And again, definitely look this up in your individual territories because it may differ. But when it comes to a physician assistant, the general consensus is that they are, they sort of rely more upon the collaboration between themselves and the physician. So a PA can't necessarily just operate on their own. They need to have some association, some tie clinically and legally to a physician. When it comes to a nurse practitioner, they are thought of as more autonomous. And you'll see evidence of this when you're going into like a drugstore, whether it's a Walgreens and their Take Care clinic, or a CVS and their CVS Minute clinic, and whatever different pharmacies you may have in your area. But the nurse practitioner is the one that is used, not the physician assistant. At least that's how it is currently, and that is because they are thought of as more autonomous. And that is one of the whether it's true or not, and in some cases it is true, and perception sometimes is reality, but this is one of those instances where a lot of times it is true. The nurse practitioner is in many cases more autonomous. One other big difference between nurse practitioners and physician assistants is the types of patients they can see. A physician assistant, regardless of what type of medicine they're practicing, can see patients from, as they say, birth to death, meaning they can see infants all the way through palliative care, geriatrics, and all of that until death. The nurse practitioner in order for them to see a certain type of patient, they have different certifications that allow them to see different patients. So for instance, while a physician assistant, regardless, once they graduate, can see any type of patient, literally in any specialty, any age, it does not matter. There are no restrictions. When it comes to a nurse practitioner, they are limited by the certification that they hold. There is psychiatric certification. They can only see psychiatric patients and bill for those patients. Pediatric, they can only see patients up from infant and birth all the way up to age of 22. Family practice. Family practice is the widest scope. They can see anything from birth to death. Family, think, birth all the way up until death. Adult geriatric, they can only start seeing individuals, I believe, at the age of 18 or 22. It's going to depend. Acute care. That actually is an interesting one where it only allows nurse practitioners to see patients, at least in Connecticut, from 16 and above. They cannot legally see anybody under the age of 16. So anytime that you get a position and that position is requiring you to find somebody that is like for a family practice, let's say, you cannot place an adult practice certified nurse practitioner into that position. However, you can place a physician assistant, if they'll accept one, into that placement. So again, you have to be very mindful anytime that you have a placement, you're filling a job, who can and can't go into these instances and into these placements. And a lot of times a provider or a administrator, a practice manager, what have you, will say, maybe a physician, him or herself, will say, listen, I'd love to get a nurse practitioner, or I'd love to get just a physician assistant. Well, you can say, well, what about a nurse practitioner? Well, you said you wanted a nurse practitioner. What about a physician assistant? Let me talk to you a little bit about that. Now, they may have their perceptions about a nurse practitioner versus a PA, but a lot of times, if you can overcome those perceptions, because they maybe had just like one or two bad experiences, and by the way, that will take hold. I mean, they will say, nope, had a bad experience with a nurse practitioner, don't want any more, just want PAs. If you can overcome those objections, then you can widen the scope of what you'll be able to find for that practice. And you'll literally double your chances of trying to find someone that will get into that practice, because now not only are you considering, let's say, just PAs, but you've now talked that physician in and explained the benefits of why a nurse practitioner would also be a good fit. A lot of times a physician, if they're doing the hiring, they like to maintain control, and they will only want a physician assistant because they know that they are subordinate in many ways to the physician, and that they take directive and orders from the physician, whereas a nurse practitioner does not, and they are more autonomous, and they make decisions for themselves, and they may go outside the box. And in many ways, for a controlling physician, that is not something that they often like to have. So those are some of the differences between a physician and a physician assistant. Another big one, a nurse practitioner and a physician assistant. Another big difference is the way that they are trained. Each individual is trained differently. The physician assistant is trained under the medical model. Now, the medical model is exactly the same type of medical model training model that a physician is trained under. The nurse and the nurse practitioner are trained under the nursing model. It is a different approach. Educate yourself on what the differences are, but there are specific differences in terms of how they are trained. And, just think of it in general terms, whereas the medical model goes down a very specific pathway, and the nursing model is more of a compassionate, treating more of the entire patient, caring for them, that sort of thing. A lot of times physicians will also say, well, you know what, I don't have time, I need my clinicians to just, see patients, boom, 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 I need a But a lot of times the nurse practitioner doesn't, they're not like a regular nurse where they're spending, that's the perception. Again, here comes the perception where they're spending inordinate amount of time with the patients and not seeing the 20 patients necessary in order to make, to be profitable in a practice. So overcoming those perceptions is definitely something that, you may find yourself doing more often than not. And as far as one of the other just big things, and I want to stress this, is that a physician assistant is sort of like your utility player. They can work in pediatrics 1 year, say, I've had enough of this, I want to go and work in orthopedic surgery, I'm done with this, after 5 years I'm going to go and be a hospitalist, work in hospital medicine in an inpatient environment, I'm done with this, I'm going back to family practice, or I'm going to internal medicine. They can bounce from specialty to specialty, oftentimes at the detriment of their own career, because if you see this bouncing from back and forth, then someone may say, well, it looks like you have great experience in this, but we need someone for this, and despite the fact that you've got all these years of clinical experience. A nurse practitioner, by the very nature of them being almost in some ways pigeonholed into a certain age type or a certain type of patient population, will establish more of a stable career. And for instance, you can have a nurse practitioner that is a pediatric nurse practitioner. Well, obviously, he or she can only work in pediatrics, and they can only see patients that are from birth up until 22. And just by that very nature, they will keep established a very specific type of career where very predictable in pediatrics, for however many years, you're not going to see a lot of variability or variables in that. And that alone will help to establish them in terms of being more stable. So yeah, that's really a big difference that should not be overlooked in the differences between the PA and the APRN. Going back to their schooling, their education for their master's degree, because again, when they become a nurse practitioner, that is a master's degree. When they become a physician assistant, that is a master's degree. They follow very similar types of education. For the first year or thereabouts, each of those individual programs are learning in the classroom. They're spending time in a didactic setting, didactic classroom setting. And at that second year point or thereabouts, sometimes it's, depends on the program, 18, 16 months, what have you, they are spending time in their clinicals, in their rotations. Clinicals are generally what nurse practitioners do. Rotations are generally what physician assistants do. Preceptorships, that's another one. There's all different types of terms, but that means that they're going out and they're spending time doing those rotations or clinicals. They're actually in a clinical setting, learning on the job. Think of it, if you know any friends or you yourself, I know I did this, is that I spent time when I was in college in an education setting. I learned in a classroom, and then for that final year, took it out to the classroom and actually practiced what I learned in the classroom setting, but now I'm in a classroom setting. So they do the same type of thing in PA and APRN school. So a lot of times they will have these core rotations or clinicals that they have to do. A lot of times they're your foundational sort of specialties: internal med, family practice, primary care, those types of positions. And then they will have their electives, where if a PA really likes, orthopedic surgery or surgery, they're very surgical centric, they will then choose different surgery rotations, like general surgery, like orthopedic, maybe even subspecialize. Meaning that if it's orthopedic, they're subspecializing in just like joint cases, or just hand or wrist or foot. So it gets even more specialized than just broader orthopedic general surgery. Which brings me to another point, which is that physician assistants are generally the ones that do surgical procedures. There is not, to the best of my knowledge, at this time, any type of certification or program that is readily available that will teach a nurse practitioner how to become a surgical nurse practitioner. It does exist, but it's very, very, very rare. It is a lot of times now being offered by a hospital if they do their clinicals in a hospital to learn how to do surgery, because they're in that setting. A lot of times a nurse practitioner will want to do that, but it's generally one of those things that a physician assistant is, 9.5 out of 10 times, if not 9.9 out of 10 times, it will be the PA, the physician assistant, that engages in any type of surgical. Very, very rarely, and I've had instances, so it's not an absolute, but there are some instances where a nurse practitioner will engage or will want to go into a surgical position, but it's very, very rare. In the same way, physician assistants, again, at least in Connecticut, and this may differ, I know it does differ in individual states, will not go into psychiatry because it can't be billed properly. So all of this, in many instances, has, in terms of what specialty a PA or an APRN goes into, will be dictated by insurance companies that will bill or that will allow companies, practices, hospitals to be reimbursed for the specific type of work that the PA or APRN does. And here's an example. In Connecticut, in a clinical setting, a physician assistant cannot be billed at the same rate that a nurse practitioner for psychiatry can be billed. So again, we're talking about a psych practice, and let's say that the practice says to me, John, I need you to find someone for, to do medication management for these patients that we have here. Great. So I go out and I find a PA, and they say, and this has happened. They say, you know what, this person is very qualified. They have the credentials, they have the qualifications, they picked this up somewhere along in their career. The problem is we can't bill properly for them, or we can't bill at the 100% rate or the 90% rate or whatever it might be in order to be reimbursed. So if we can get someone that can get reimbursed at 100% versus someone that's going to get reimbursed at an 80% rate, well, we're going to have to take the 100% because it's the same amount of time. We're going to have to pay them the same, but we're going to get 20% less if we use a PA. So that can be one of the fundamental flaws in having a candidate that is very qualified at what they do, but they're not, but it's a PA and it's not a nurse practitioner and it's in psych. So what you'll have to do on your own is find out all the different specialties and get to know which one, from acute care all the way down to urgent care and vein therapy or whatever, from A to Z, and find out in your specific territory what the preference is. The preference for, let me clarify, the preference for whether a PA or a nurse practitioner will be in any of those individual specialties, and go down the line. And in Salesforce, you'll find that in that specialty 1 category, that's your sort of template. Just look down the line, it'll have all the specialties that you'll ever possibly come in contact with, and get to know which PA or APRN is utilized most or both in each of those individual specialties in your territory. So I hope that this helps. This is just sort of a primer for the differences between a nurse practitioner and a physician assistant. A lot of times, like I said, it comes down to preference. A lot of times it comes down to legally what they can do. And a lot of times it will even come down to what an insurance company will reimburse for, depending on whether it's a nurse practitioner or a physician assistant.